Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics, and all my videos are directly referenced from the internationally accepted US National Medical Library, and therefore you can trust the information given in my videos. So today I'm going to talk about hemorrhoids or piles. This has been requested a couple of times in my comments, rather more than that. So I'm going to cover this in utter details. We are going to cover the causes, the symptoms, almost everything which you need to know about hemorrhoids, the treatment, the test, etc., etc., etc. So don't go anywhere. I'll be back.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Hemorrhoids are swollen veins in your anus. Yes, they are inside your anus or in the lower part of the rectum, just above the anus, right? They are basically coming from inside the anus. Basically, mucous membrane is there inside your anus and there are veins, right? So these veins are basically dilated or swollen. So why would this happen? And actually it is very common. It is very common. And this actually happens because of increased pressure on the anus, right? Because of straining during fecal movement, during passing stools, right? So this can occur even during pregnancy or childbirth, or obviously because of constipation, right? So this pressure causes the normal anal veins and even the tissue around the veins to swell. All right, so there is swelling, and because of this swelling, these tissues become big, the veins become very big, and then it can bleed, right? Therefore, often because when the feces will pass through this swollen veins, it can actually cause friction, and sometimes it can bleed, right? That is the issue. So hemorrhoids can be because of straining during bowel movement. It can be because of constipation. It can be because of sitting for long period of time also, especially on the toilet, right? Then even because of certain diseases like liver disease, liver cirrhosis, or advanced alcoholic liver disease, this can happen. All right. So you need to understand that these can be of two types, internal and external. They can be just inside the body, so you might not even see them ever. Or sometimes the veins get so dilated, so big, so swollen that a part of the vein or the tissue might be coming out of the anus. So it might come outside the body also, right? So internal hemorrhoids are inside the anus at the beginning of the rectum. So they are above, and when they are large they may fall outside, which is basically in medical terms called prolapse, right? The most common problem with internal hemorrhoid is bleeding, right? Obviously, as I said, this can happen during bowel movements. And external hemorrhoids, they occur outside the anus. External hemorrhoid can result in difficulty in cleaning the anus. Obviously, if they are outside, it would be difficult to keep that area hygienic, right? And if a blood clot is formed inside these external hemorrhoids, external piles, can be very painful, and this condition is basically called thrombosed external hemorrhoid, and it is a very urgent surgical condition where you need to have a surgery right away, right? So the basic symptom of any type of hemorrhoid is no. But remember, hemorrhoids usually do not pain. Most often they are not painful. But if you have a blood clot inside the hemorrhoid, inside the piles, then they can be very painful, right? So apart from this, what can be the symptom? Symptoms are painless, bright red color of blood coming through the rectum, right? Bright red colored blood coming through the rectum, anal itching, anal ache or pain, especially while sitting, or pain during bowel movements, or sometimes there can be one or more tender lumps near the anus. So these are the symptoms. And the test needed to diagnose this condition, most of the times a doctor can diagnose by just looking at the rectal anal area, and sometimes they can actually do a digital rectal examination, right? And external hemorrhoids can be just seen from outside, and obviously rectal exam can be done. If needed, sigmoidoscopy or anoscopy can be done to have a better look inside what is going on. So these are the tests which actually can be used to diagnose the condition. And the treatment of hemorrhoids or piles, they include, number one, first target is to reduce the swelling. So because of the irritation, because of the friction of the stools, there can be swelling around that veins or the tissue. So to reduce the swelling and the pain, over the counter steroids like cortisone creams are used to give that relief of the pain and swelling. Then hemorrhoid creams are available like lidocaine. This helps to reduce the pain. These creams are applied 15-20 minutes prior to defecation before you go to pass your stools. And third most important thing is stool softener. Yes, you need to soften your stools, because the more hard stools you have, the more they will cause friction to these dilated veins and the more chances of complications. So stool softeners help to reduce straining, it helps to reduce constipation. So further, increase in these vein size will be prevented, friction will be prevented, bleeding, irritation will be prevented. So these are basic treatments. And the second thing which you can do is you can actually sit in lukewarm water for 15-20 minutes, which is basically called sitz bath. Sitz bath can actually help you feel better. You need to sit in warm water. Okay, don't sit in hot water or cold water. Warm water without any clothes, sit there for 15-20 minutes, 2 3 4 times a day, right, as much as you need, right? Then other things which you can do to reduce itching is, you can, if you have itching around the anal area, you can apply some calamine lotion, witch hazel, to the area with a cotton swab. You can wear cotton underwears. Avoid using tissue papers with have colors or perfumes. Use baby wipes. If you use tissue papers, use baby wipes inside. And try not to scratch the area. That's most important, right? Then if your hemorrhoids are not getting better with all these home remedies, simple remedies, you may need to see some type of you may need some type of office treatment, clinical treatment, to shrink the hemorrhoids. The injections are available, surgeries are available. If office treatment is not enough, only then we go for surgeries. Office clinical treatment include these injections, right? And surgery can be done. That means the hemorrhoid, the dilated vein can be removed. The swollen vein can be removed. Hemorrhoidectomy can be done. And these procedures are generally used for people with very severe bleeding or prolapse who are not responding to other treatment, right? So this is all about hemorrhoids. This is nothing else to know. There is nothing else. There is no other treatment, no other uh, thing to decrease the size of the vein, right? If there is a liver problem, you need to deal with that first, obviously. Then if you don't treat it, obviously possibly there can be complications like blood clot. There can be the tissue around the hemorrhoid can die and cause necrosis. And in these kind of cases, bleeding can lead to anemia, iron deficiency anemia, and other things. Nutritional deficiency can happen because of anemia and other things, right? So a lot of complications can occur. So if you have any kind of rectal bleed, irritation, or anything coming out of your anus, if you're bleeding and you're feeling dizzy, lightheaded, fainting, then go and get a health checkup. Consult a surgeon, tell your concern. They'll do the examination, necessary tests, and diagnose if you have this condition or not, right? Prevention is possible in this case. Obviously, constipation and straining during bowel movements and sitting on the toilet for a long time are the main causes of hemorrhoids, so avoid them, right? You should basically drink a lot of fluid, a lot of water, right, so that your bowels are not so hard, and eat a high fiber diet with a lot of fruits, vegetables, whole grains, right? Consider using fiber supplements if you can tolerate Bananas are very good and natural laxatives. If you can tolerate bananas, then use bananas. Bananas are natural laxatives. You can eat 2, 3, 4 bananas on a daily basis. Consider using a fiber supplement. Sometimes high fiber diet. Slowly, if you increase high fiber and fluids, your motions will become regular. Constipation will get relieved. You can watch my video on constipation separately, and you can use stool softeners if needed to prevent straining, but stop straining, stop your constipation. Right, all these things can lead to hemorrhoids or piles. They are also called rectal lump. They are also called lump in the rectum. Right, so don't worry about it. These are not very serious. These are not life threatening. Get it treated if you have these conditions. And those who don't know me, I am a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel. So don't forget to subscribe and hit the bell icon. Don't forget to subscribe my other channel, Dr. Education FAQs, which answers your question in simple short videos. And stay connected, stay healthy.